I'm Dr. Kristine Kiat. I'm a board-certified pediatrician, and in my weekly videos, I give you support on how to raise happy and healthy kids. At the end of my videos, I always provide action steps or steps that you can take right now to help your child. In this video, we are going to talk about ADHD or Attention Deficit Hyperactivity Disorder. We will discuss its definition. What are the behavior symptoms? What are the types? When should you worry and call your pediatrician? And how doctors diagnose this condition. And of course, watch until the end because I will provide you with action steps. Alright, I hope you enjoyed the video. Thanks for watching! Does your child have ADHD? A child's behavior can get out of control and crash everything around him, or make a lot of noise, or will not pay attention. But in some children, it is not only an occasional problem, but a chronic problem that has been going on for a long time, which can be severe and might interfere with life at home, in school, or with friends. We worry that these are the children that might have ADHD or Attention Deficit Hyperactivity Disorder. ADHD is a neurobehavioral condition in children which is chronic, which means it has been going on for a while. It is twice as commonly diagnosed in boys than in girls, and you need not worry because effective treatment is available. There are three main groups of behavior symptoms in ADHD. The first symptom you're going to talk about is that of inattention, where the child is often described as a hard time paying attention, does not seem to listen most of the time, is easily distracted in school, makes a lot of careless mistakes. When he has a chore, he tends not to finish his homework or his chore at home. They tend to lose important things more often than not. They forget things all the time. They tend to be disorganized. And they tend to avoid doing stuff that require mental effort. Another group of ADHD symptom is that of hyperactivity. A child is described to be in constant motion as if driven by a motor. The child cannot stay seated, fidgets, or squirms all the time. Talks a lot, and this is often too much. They run, climb, or jump even if they're not allowed to do so. And they cannot play quietly, and you would notice it if they're around other kids. And the last group of behavior symptom in ADHD is that of impulsivity, where the child acts and speaks often without thinking. They tend to run into the street without looking at traffic signs. And so it has become a safety problem. They have a hard time taking turns. They call out answers in class even before the question is done. They tend to interrupt others like their teacher or other classmates. And they have a hard time waiting for things. Not all children with ADHD have the three behavior symptoms present. The children are classified according to these three types of ADHD. The first type is the inattentive only, which tend to be the children with the most inattention problem, but they are not overactive in the classroom, so they're least likely to be noticed. This is the type that is most commonly seen in girls. The next type of ADHD is the hyperactive impulsive type, which has two of the behavior symptoms, but these children tend to pay attention. It is the least common type. And lastly, the combined inattentive, hyperactive, impulsive type has all the three behavior symptoms, and it is the type that people most commonly think about when we say ADHD. The early signs of ADHD. It is usually noticed when the children enter elementary school. The reason for the delay is that in preschool children, it is common for them to have symptoms of inattention, hyperactivity, and impulsivity, and then these children would outgrow these symptoms. But in children with ADHD, they do not. In a classroom, it highlights the problems of a child with ADHD because children are taught to focus, to have self-control, and to be patient. Usually by age 7, the parents notice that their kid's level of inattention is already more than the usual. What parents usually say? Well, they say, "My kid has a lot of energy all the time. When does he ever settle down?" Or for those with primarily inattention problems, they would say, "My kid is daydreaming all the time." Or they tend to lose things all the time. Well, they also tend to forget their chores, like I ask him to go to his room and change his clothes. When I go up, he's playing with his toys. We pediatricians diagnose ADHD based on a set of guidelines set by the American Academy of Pediatrics. Diagnosis is specific for children 4 to 18 years of age. This is because in younger kids, it is more difficult to assess them because their symptoms may rapidly change. There is no single test to diagnose ADHD. It is a process that takes a while to gather information from you, the parents, teachers, and other caregivers like the coach or music teacher or church leader. And after a thorough evaluation, we then diagnose ADHD. Guidelines to the diagnosis of ADHD. The symptoms, the behavior symptoms, should happen in 2 or more settings. One setting can be at home, another could be in school, or in other social situations like in sports. In children 4 to 17 years of age, there should at least be 6 symptoms present. And thirdly, there should be significant impairment in the child's daily activities, like is home situation affected, like how does he relate to his other siblings, or schoolwork, is it affected as well? Is he having difficulty in school, or how he relates with friends? Also of note, the symptoms should happen before 12 years of age. And lastly, the symptoms should be chronic, wherein it should be present for more than 6 months. Alright, now we're into the action steps on what you can do to help your child. Action step 1. Parents are very important. Parents have a crucial role in a child with ADHD. Take note of your child's symptoms or behavior and how long has this been going on. Make a list. Also take note on how he relates to other people at home. There is a checklist or a rating scale available with your doctor, so ask your doctor about it. Action step 2. Safety first. Keep safety in mind because a child with ADHD is not always aware of the dangers around him. So take note of the firearm, poison, potential poisons, equipment or tools like lawnmowers, and also traffic. Action step 3. Get the school involved. It is important that you talk to your child's classroom teacher and ask about your child's behavior. How long has this been going on? And how it relates to his progress in school. Is it affecting his schoolwork? Get examples of report cards, standardized tests, and other schoolwork to show to your doctor. Action step 4. Get the other caregivers involved, like a coach, or nanny, or a religious leader, or a music teacher. And action step 5. Classroom techniques on what we can do to help your child. So, children with ADHD Do better with a set routine. Also, have a system of rewards and consequences. And ask your teacher if they can send a weekly or daily report card to the parents to help to tell them about their child's progress. It is advisable also for a child with ADHD to sit near the teacher. Small groups are always helpful. It helps a child with ADHD with their inattention if they're in a small group. And keep the homework short, and close supervision is always important. Alright, that's the end of our video. I hope this helped you a lot. Thank you for watching!
Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?